Good evening, everyone. My name is Sam Elfassy, and I am the chair of the hospital board at North York General, and also privileged also to serve as the vice president of safety and security for Air Canada. It's a pleasure to have you, many of you actually, join us tonight. My apologies for starting a little bit late. We're just having a little bit of technical difficulties, but we're going to get over that in a few minutes. We're going to introduce Dr. Joshua Tepper in a couple of seconds here as our president and CEO of North York General. And we'll also be joined by Ron Johnson, who's the editorial director of Post City Magazine, and he'll moderate our discussions. Dr. Tepper and I agree that all the tough questions will actually go to Dr. Tepper. And he's also promised that if we get a very good rounding successful review to this first house calls, that he will allow his wife Sophie to cut my hair, because I am actually looking for a haircut after all these months in isolation. So with that said, really excited about this evening's session. So Dr. Tepper, over to you.
Great, thank you so much, Sam, and I appreciate the introduction. It's lovely to be here, and let me start by thanking all of you for taking time to join us tonight. And thank you as well for being members of our community and supporting the hospital and our frontline, just the fantastic frontline people we have here in so many ways. So thank you for your support. Very much looking forward to tonight. My wife Sam would do a lovely job, but there's 6 feet shears, so you know it's a little more challenging. Certainly look forward to the conversation and the questions.
All right, thank you both. I'm sorry I can't be there via video, but I'll try it this way. We have some questions that have already been submitted from our community. We'll start with you, Samuel. When do you predict I can freely move around Canada for business? How about international flights? How about the United States? Summer is coming. When will I be able to jump on a plane for a vacation?
Wow, those are a bunch of questions. Let me just first perhaps start by saying this. We restarting aviation, because right now there is no adjective that can actually describe the pandemic's cataclysmic effect upon our industry, nor can numbers actually fully quantify the extent of the financial devastation that the global airline industry is experiencing and will experience for some time, whether it's the government-imposed lockdowns and the travel restrictions the world over. It is absolutely significant, and as I've mentioned to a number of my colleagues, and when I do have these types of conversations, we're now living through the darkest period ever in the history of commercial aviation, significantly worse than the aftermath of 9/11 and SARS, or the 2008 global financial crisis. So that helps establish a little bit of context in trying to answer that question, because every challenge in aviation requires a team effort to solve it, and today, as I said, we're facing the biggest challenge in commercial aviation history. We're restarting an industry that's largely ceased to operate across borders. In our case at Air Canada, we are operating less than 5% of what we would normally, meaning that 95% of our schedule has been eliminated because of those restrictions. So how do you restart it while ensuring that the industry is not a meaningful vector for the spread of COVID-19? And that meeting those challenges really is a significant change in the way I think all of you would experience the arc of travel experience, pre-flight, at the departure airport, on board, or even post-flight. And it's going to require a number of things to all come together. They all are coming together right now, but certainly a number of things to come together that will allow you to travel and more importantly, try to restore the confidence in the safety of air travel, because that's going to be really a vital prerequisite to enable the global economy to recover from COVID-19. Our government will have to assume broad new responsibilities in terms of assessing and identifying health risks, no different than they did for security after 9/11, and we as an airline will, and airports for that matter, will need to really introduce, adapt a number of processes and procedures to minimize the risk in the airport or in the aircraft environment. And then the last, the one I often refer to as the three-legged stool, because the third, which is very, very important, is passengers, all of our customers, will need to be empowered to really take more control of their travel journey, and that includes a responsibility, in fact, for assessing their own level of health risk before a journey. So, you know, there's going to be a lot of things that need to come together in order for us to get back to where, frankly, we were back in 2019. But we have an abridged schedule that we've issued as Air Canada. The U.S. borders, as many of you know, very complicated as to what the restrictions are to go in and out. As a Canadian, you are permitted to go in and out of the United States freely. It is not required for you to demonstrate essential travel. We've essentially stopped flying there, but we are opening up a lot of our schedule because now there is a demand. It's slowly coming back, which is a good thing. But individuals that might be in the United States are considered a foreign national when they're coming into Canada. It's a very, very different story. There's different requirements, but certainly right now there is a requirement that for any of the customers coming back into Canada, that there is a requirement for a quarantine 14-day period, as many of you are aware of, when you do return. So a very long-winded answer, but it will recover. It will primarily require the public health agencies that are out there to drive an understanding of what the level of risk is. Then it's the government restrictions, confidence to increase in travel, and then whether or not the industry has the capacity to carry people. Maybe I'll stop there, Ron, and throw it back to you.
All right. So what very interesting stuff. What kind of mandatory precautions are in place now, even with regards to domestic flights? For example, taking temperatures, PPE on flights, or any kind of restrictions like that?
Yeah. So right now, that whole travel journey itself has changed. I should say at the outset that the state of knowledge right now is changing rapidly, because I can tell you there's hundreds of research articles. I spend the better part of the beginning of my day actually doing a literature review with my chief medical officer, Dr. Jim Chung, and we look at an enormous amount of work that has been completed that drives our decision making. And a lot of what we've introduced, and we have in fact led on, has been based on sound medical evidence and based on the published research in the area of in-flight transmission. So if you're traveling today, you're coming on board, there's a requirement for temperature screening. Fever is an early sign of COVID-19 in some people, but by no means all. It has some limitations, but we've adopted that as part of a multi-layered risk mitigation. So if you measure over 37.5 degrees Celsius, we have very specific procedures of what we do before you're permitted to get on board. There's a requirement to complete a questionnaire asking you about symptoms, usually fever, cough, breathing difficulties, to detect the possibility of individuals that might be symptomatic. We have a requirement for individuals to wear face coverings, and you should know that many airport authorities are now introducing, as many of you might hear or have heard, the Toronto Airport Authority mandating the requirement to wear masks at any point you're in the terminal facility. That was something that we largely drove, but if you're on board, a mask is required. There's requirements for physical distancing in the areas around the terminal facility, and to the extent that we can on board the aircraft. The cleaning and disinfection is something that folks do not see, but as many of you know, the primary route of transmission is really directly through respiratory droplet spread. Although the transfer on fomite, hard surfaces, is also very, very important. So we used hospital-grade disinfectant to to clean the aircraft, along with these what they refer to as these electrostatic sprayers. We do minimize service and contact with our customers right now on board to not allow for close physical contact with our customers. So those are some of the things that are on board right now that they would experience.
All right, and before I let you off the hook, I just wanted to ask you quickly. You mentioned the mandatory quarantines, but could you talk briefly about air circulation and filtering systems? I know that's been a concern for people with regards to how the air is circulated in the aircraft, and I think you've mentioned some interesting points on that.
Yeah, so good question. I would start by first saying, and I've had this discussion with a number of friends that are out there, and I often start with the fact that based on everything that I've understood and studied, you don't get sick on airplanes any more than anywhere else in the world. You really don't. And if you think that's a preposterous or even a dangerous thing to suggest during a pandemic, you consider a number of very, very specific facts. And certainly one of them relates to specifically the ventilation systems that are on board aircraft. And I don't want to get too technical here, but an aircraft environment delivers 10 to 12 air changes per hour. And that means that the entire volume of air within the fuselage of an aircraft is exchanged every 10 to 12 times per hour. And that's actually quite significant. And to give you an analogy of what that actually means, in a hospital isolation room, the minimum target is usually 6 air changes per hour for existing facilities, and it's 12 air changes per hour for new. So it is refresh no different than an isolation room in a hospital. And plus, the air actually goes through what is referred to as HEPA filters, and these filters are recommended not only by the CDC, the Center for Disease Control in the United States, but also by the Public Health Agency of Canada. HEPA filters are required also for isolation rooms in a hospital environment, and that coupled with a number of other dynamics within an aircraft environment and how air flows through and circulates and how it's replenished makes it a very, very different environment than your home or an office environment that people typically are accustomed to.
All right, thank you. So we'll swing it over to Dr. Tepper now. We'll start with there's been a fair amount of new information with regards to testing lately. So I wanted to ask you, when should I be getting tested for COVID?
Yeah, thank you for that. And this has changed not quite day by day, but almost week by week. Basically, and it changes by province as well, but the current recommendation in Ontario is that anybody who wishes to be tested can be tested. And so if anybody listening, watching, feels they want to be tested, for whatever reason, they can go to one of the provincial assessment centers and request a test will be done, and nobody will be turned away. Certainly some of the times when we think somebody is at higher risk of being tested, certainly if they're having symptoms, fever, cough, shortness of breath. But again, the list of symptoms that potentially fall into this is broadened a lot. So headaches as well, diarrhea, other symptoms. So if you're feeling unwell, you might certainly want to get tested. Often if you're going to be receiving a procedure or surgery or something in a hospital, you'll often be tested. And if you've been in touch or in contact with somebody in a closed space who is tested positive, you're going to want to be tested. But again, the bottom line is at this point, anybody who wishes to be tested can be tested, and you can go to one of the provincial assessment centers.
Ron?
I'll give Ron a minute. The two testing centers that we have Our one testing center that we run 8 a.m. to 8 p.m. every day is at our Branson campus over Finch area, and then also outside of our emergency room, connected to our emergency room, we have a 24/7 testing center as well, and the Branson site is open weekends as well, 8 to 8. So again, certainly encourage people to make use. We've got a great team in both places. I have a lot more I could say about testing.
Dr. Tepper, I don't know if we lost Ron, but can you hear me okay?
Absolutely.
Yeah. Actually, let me just build on that, kind of just intersect with a point that you made. I don't know if Annette, if you want to go live to me, or just leave it on Dr. Tepper, but there's been a lot of discussion in the aviation context around immunity passports, right? So after you test, you test as though either you've recovered, that you would have this imaginary world where you would be given some sort of certificate that allows you to move about freely. There's been a lot of discussion in aviation about that, and we happen to think that it's not a great idea, and for many reasons. Well, it's happened before, and I remind friends that I've spoken to about this that for many of you remember that most of the 19th century, immunity to yellow fever really divided individuals in the United States between those that were acclimated and those that were not. And I think that introducing immunity passports in an effort to kind of reverse what we're seeing could have disastrous consequences, frankly, on many levels and many flaws associated with it. But I think perhaps for another conversation, or
I think there's a couple other problems, I might say, beyond, I think, sort of the ethical problems that you were alluding to. First of all is the availability of the test. Mm-hmm. The second thing, my apologies. The availability of the test, the accuracy of the test is still something that we're concerned about. And also, we don't know enough about immunity. How high do the titers have to be? How long will the immunity last? How thorough is that immunity? So, I think there's still, just setting aside, I think the very, very thoughtful questions you raised are some fundamental questions as well, just about the science still.
Yeah. And focusing, instead of immunity passports, and investing available time, talent, and money in two more important things, which is the first, the tried and true formula of pandemic damage limitation, which is test, trace, and isolate. And there's been a lot of success in that. One of our board members at Air Canada is charged with the response and the recovery as well down in New Zealand. They've had tremendous success using that approach. And second is the development and production and global distribution of a vaccine, because that's where the focus should be.
I think there's an unbelievable amount of focus on vaccine and sort of unprecedented progress. It's sort of amazing how fast this is moving. Still a lot of questions about vaccines, to be honest, Sam. First of all, we have to remember there are diseases out there like HIV that we haven't been able to create a vaccine for, despite huge efforts. Hopefully we can. And then the question is, will this be one of the vaccines like the polio one, where it's sort of the same vaccine forever, or is it going to be more like the flu, where we need to adjust it every year? And there'll also be some interesting questions as well. Is this something like that you'll need boosters of, or will one dose sort of do you for 5 years, 10 years? So I think a lot of excitement and unbelievable progress on vaccines, but far from a fait accompli. And of course, there's safety. One of the things we need to be so proud of is the safety of our vaccine. And I know there's a lot of disinformation about the safety, but our current vaccines are safe. And we want to make sure that any new vaccine that comes to market has the same quality and the same safety as the existing ones. And so safety, mass production, Does it need to change over time? How often do people need to get it? So thoughtful questions that we need to run to ground.
Go ahead, Ron.
Hey, Joshua, there's some questions here that I think we'll build on what you raised earlier. One is interesting here. As isolation and safety guidelines are relaxed, can people over 70 relax at the same rate, or should we be more cautious?
I mean, I think the bottom line is you need to be more cautious. If there's, the data has changed around the world, but one very consistent piece of data pretty well everywhere is that unfortunately this disease is far more deadly, for lack of a gentler term. There's a higher mortality rate, if I was going to be scientific about it. It's far more dangerous for people who are older, and just in country after country, the people who get sick, the age range of people who get sick is surprisingly well balanced between 20 to 80, but and above. But the people who are getting seriously sick and dying are the older. And so, yes, if you have comorbidities, if you have complex health conditions, and if you're older, you're going to need to be much more attentive to these issues, unfortunately. And you're going to have to be much more careful about remaining sort of in greater degrees of physical distancing.
So I guess that answers that next question, which is how long will we have to go before interacting or hugging our grandchildren, which is something that I know I hear of very often. I think it's going to be a bit of an individual call. It's going to be about individual risk as well. We've talked about bubbles and merging bubbles. And remember, you're sort of merging your bubble with everybody that person has merged their bubbles with. And so, I've had people say, listen, we've been in total isolation and physical distancing for 4 weeks. We're very confident this other family, my grandkids, have been as well. And if you have a high degree of security and confidence about that, then you may choose to make it, to take a calculated or a sort of thoughtful risk. But if you have somebody who's your family members are out and about a lot, whose children are perhaps out and about for different reasons or in contact, that bubble has a lot of other contact, and you're elderly or you have medical problems, you might want to be a lot more cautious. And so these questions of merging bubbles is going to be an increasingly complex one as we naturally seek to rebuild community and connection physically, and as people start to socialize more and circulate more in society. Mm-hmm. I had a question that brought us back to your earlier comment on testing and itself. But before I do that, maybe respond to that. Ron, are you back with us?
Yes, I'm here. Hi, guys.
Oh,
because Sam seemed to have a lot of questions for me, and I didn't seem to have any available for him. So,
well, look, I'll go back because there was a question. I took a peek at the queue on the right-hand side there, and then maybe I'll answer this one and maybe comment on it, and then Ron will hand it back to you. Happy that you're back with us. We were chatting about testing, and somebody's asked me a question around, do you see testing actually being conducted in the airport, before getting on board the airplane, to give that level of assurance that it's a safe environment? Kind of go back to what I said earlier, is that there's this confidence that needs to be established, and certainly a lot of you feel that. I should say that the mainstay of testing for current infection is you probably read, as polymerase chain reaction PCR test, which involves taking a swab of the upper throat and kind of growing the genetic material in the laboratory until it can be detected and confirmed. The testing in that particular area, and Dr. Tepper will correct me here, it's been recognized for a lot of false negative rate, and in other words, it misses some people with the infection. So rapid point of care testing is sufficiently reliable and capable of delivering some rapid results, provided that we deal with the reliability of the test. And it's no different with antibody testing as well. Current advice is that there are no validated and reliable antibody tests for use on an individual level that we're aware of. So we're not pursuing anything like that right now. What we are are the layered approach that I made reference to. So, contact tracing, which we're involved in with health authorities, and one additional one that I didn't comment on, which relates to our crew members, the health and safety, obviously, of our employees and my fellow colleagues is of paramount importance, and as it is for our customers. But in order for our employees to travel as they do on international flights and not to be required to quarantine for 14 days, they're required to follow some very, very specific protocols as they're away. And because of that, as an essential worker, they're considered not to have to quarantine. And again, it's provided that they remain on layover in the hotel, in the room. They cannot be permitted out and about. And we verify that through a number of different means. And we also ensure that transportation for our colleagues allows them to isolate to the extent that they can. So all those layers, absent testing right now for us. So Ron, back to you.
All right, thanks. You did mention antibody testing, and that is something I hope you guys haven't covered yet, because I'd really actually like to know the basics of what an antibody test is, and if people should be thinking about getting those tests. Dr. Tepper.
We did cover that a little bit, but I'll take the first part of your question, which is what is an antibody test? So when you get sick, bacterial or viral, your body responds and it creates additional antibodies. And those antibodies then continue to circulate so that the next time you get sick, your immune system is able to respond more quickly because it already recognizes this disease and already has a lot of antibodies in circulation. And so the idea of an antibody test is that I think there's a couple ways that we're hearing a lot about it. The first is what Sam talked about, is the immunity passport or testing people. And I do think we talked quite a bit about that issue respectfully. The other area is as a potential cure or a treatment. And so what you are seeing is people's plasma being taken, their blood, and a subset of their blood, the plasma, and a subset of that is the antibodies being taken from people who have recently been sick with COVID, and they can take those antibodies and with proper preparation, inject them into somebody else. And that means that you don't have to wait for your own body to be generating the antibodies while it's under attack. You sort of get an extra dose from somebody else. And there's several clinical trials around this. There's a very large clinical trial and hospitals in Ontario are participating, including North York General. So the concept of that's what antibodies are, and two very important concepts, one around a potential treatment and one around this issue of sort of immunity, or which we've covered earlier.
All right, thank you. And now I wanted to talk a little bit about some basic safety measures as the warm weather is upon us and people are starting to wear shorter sleeves and tank tops and be outside. And we saw what happened at Trinity Bellwoods Park in downtown Toronto. I just wanted to know, kind of, is it safe to be outside, or should we continue to be isolating as much as possible? And what measures should we be taking when we're being active outside, such as jogging? I know there's a lot of talk about how to be safe jogging.
Yeah. So I think, we've got to recognize there's really important benefits to exercise, to moving your body. There's a lot of mental health and physical benefits to exercise and being outside. And we want to encourage people to be active, but we need to be safe doing it. And there's a couple things to keep in mind. So first of all, if you're out in a sort of open space with yourself and your normal bubble of family, you're fine. But there's a couple of things. First of all, how do you get into that open space? So if people are taking subways, streetcars, even elevators, if there's a high density of people moving through closed spaces to get to the outside space, that creates a risk. And so I think one of the reasons we've been cautious is not because we think it's unsafe for somebody to be sort of alone in a park or with a few other people in a park. It's because we don't want millions of Torontonians and GTA people suddenly going into closed spaces, stairwells, buses, subways, cars, Ubers, Your own private car is fine, but with others would be an issue to get to those outdoor spaces. So that's number one. And then once you're outdoors, is maintaining some degree of social distancing or physical distancing. And so again, if you're running and you're running out by yourself, no problem. But when you think about the classic running clubs where 50 people or 25 people are going to set out in a tight bunch together and run, as a group, running groups, that becomes a little bit more of a potential risk anyways, especially as you pause and you turn to speak to each other and you're huffing and puffing and you're like, how have you been? How is isolation? That group running is potentially more problematic. But for an individual to be able to get outside safely in relative isolation and then maintain that physical distancing, exercise is to be encouraged. And I would just quickly say is, as people return to exercise and people have not been at their gyms or working out, to please go back slowly. You have deconditioned a lot in a lot of ways, and so you want to go back at a much reduced rate of physical exertion than perhaps you were used to, and build that up, even however excited you are to be back at doing whatever that form of exercise is. You got to give your body time to adjust back.
All right, great, thank you. And we'll go back to Samuel now. We've heard about wait times in airports approaching 4 to 5 hours, for example, for screening, security, and all the new measures being added. Is this the new normal? Can we expect very long wait times for the foreseeable future?
Well, I wish I had a crystal ball to answer that one. I would say 4 to 5 hours is an unreasonable amount. First of all, that's not sustainable. I don't think that you can restart an industry knowing that you have to build 4 or 5 hours into your day just to get on board an aircraft. So, having said that, I think the whole environment within an airport leading through security is going to change and evolve, and we're starting to see signs of that. So, for instance, in the announcement yesterday, as I mentioned, by the airport authority here, the Greater Toronto Airport Authority, you need to have a reason to actually be in an airport facility. So you will not see a very busy environment with a lot of traffic. Individuals have to have a need to be there. That is to either assist someone who requires assistance for mobility reasons, or you're a worker. Otherwise, there's no congregating, there's no sitting around, none of that. So it is a very different, intrusive, and somewhat burdensome experience. Having said that, there will be a requirement for physical distancing as individuals queue up, and that throughput, the ability to put individuals through security, because the environment is cleaned on a frequent basis, contact with individuals is limited. That changes the dynamics. Right now, the focus is we're not seeing 4 to 5 hours. In fact, I've seen the airport environment on a daily basis, and it's nowhere close to 4 to 5 hours. We don't have the volume of individuals right now. But as we are seeing the volumes return, we're not seeing a significant wait time at this point. None that I would be overly concerned with.
All right, and the next question for you, Samuel. How can I be a good passenger at the airport and while on a plane in the context of COVID-19?
How can you be a better customer, a better passenger? Well, I would say, first, I go back to what I said earlier around meeting the challenge. Will mean significant changes across the entire arc of air travel, that whole experience. Okay, I'll go back to my earlier comments. I mentioned the responsibilities that will be assumed by government, our responsibilities, and the third was for passengers, our customers. The responsibility to assess their own level of health risk before a journey. I think we've all experienced individuals who obviously appear to be very, very unwell traveling. You will not see that, I think, in the foreseeable future for many, many reasons, both for temperature screening, screening for overall fitness to fly, and overall wellness. So What can you do? Make sure that if you're sick, if you don't need to travel, don't travel. That will only complicate matters, I think, for you. And come prepared to wear a face covering. Come prepared to respect physical distancing. Take advantage of all of the touchless changes and items that we've introduced into the whole customer journey. To the extent that you can, you'll be able, without having to touch a screen, print your own boarding card and print your own baggage tag. The whole thing is designed to be touchless. And come prepared and educate yourself. There's a lot of information that's available on our website, but information that we're not populating ourselves, we're actually directing them to the appropriate health authorities, which are the subject matter experts, whether they be, for us, the Public Health Agency of Canada, our Customs and Border Patrol, as well as to the CDC and the World Health Organization. That educates you on what that whole travel experience is going to be like. But I think first and foremost, make sure that you take responsibility for assessing your level of health risk before you fly.
I think masks are going to be a big part of this. There's no doubt. And what I would say is, and this isn't just for flying, I'd say it in general, is spend some time learning how to wear a mask. Every newspaper out there has published very thoughtful things. There's YouTube videos, there's all sorts of things. Learn how to put a mask on properly, to take it off properly, and to wear it properly. I watch people, if I'm out, I just watch, and within 5 minutes, I see people doing all sorts of things that compromise the integrity of that mask. And so both for air travel, but even outside of air travel, do take the time to use it properly. I think it's a really inexpensive and easy thing that all of us can do.
Great point. Further to that, a lot of people are buying reusable masks. Could you just outline how to safely use a reusable mask? Like, should I be washing my mask after every use?
These are cloth masks. These are sort of the homemade or the cloth masks, as opposed to surgical. Yeah, per the Air Canada. So something like the neoprene. So again, you should be washing it sort of, I would say, at the end of every day if you can. So you might want to see if Air Canada's got a couple for you. You do want them to be. They don't have to be, cleaned if you do 2 things in a day, especially if you're taking it off properly and putting it on properly, and you've maintained it in good working order. If it's if it's one that's been torn or compromised, if it's damp, then you're going to need to change it and wash it. But if it's properly cared for, dry, clean, then sort of once a day is probably pretty reasonable.
Okay. And next question for you, Dr. Tepper. We have chatted already about the risks of COVID-19, especially associated with an older population. Could you comment on how serious COVID is for children?
Yeah, there's a lot of different, that's an emerging area. I think for the most part, it is not turned, fortunately, to be a very, very serious illness for the majority of children. Now, children for whom have complex medical conditions and underlying health conditions are certainly at greater risk. And we have seen situations which we've all read about what initially was thought to be sort of a Kawasaki's vascular disease, and now it's thought to be more of a multi-system inflammatory disease. The good news is that condition that we're unfortunately reading about seems to be still exceedingly rare in the grand scheme of all infections with kids. So it's very, very rare. And in those who do get it, the vast majority of those small numbers recover quite well with supportive therapy. So in general, this has not been nearly as significant a fatal disease or a mortality issue for kids, which is good. But we do have to remember, people are like, well, send them all back to school. We have to remember that they still get sick. Some of them can still get fairly sick, and they can still spread the disease to people who can get sick, and quite seriously so, including people in their own family, teachers, etc. So around the individual kids, low risk of mortality, fortunately, but they still can get sick and they still can make other people sick. And we've seen that in different schools that have opened in different places.
Right. Okay. And further to your point, what's your opinion with regards to whether or not schools should actually reopen in the absence of a vaccine?
Yeah, Sam, I think that's your question.
Thanks,
I think it's probably unrealistic to say that schools will not open until there's a vaccine, or not completely. I think we're going to have to wait and see. One thing that we're starting to see very clearly is that this is a regional disease, increasingly a regional disease. And so we are going to see different countries in the world with different burdens, different parts of Canada with very different disease burdens, and even different parts of certain provinces, especially large provinces like ours with different disease burdens. And so you might see a very waxing, waning course, opening, closing, partially opening, partially closing, and it may vary community. And so we could imagine going back where the kids are going back for just 2 days a week and doing the rest virtually, or half days and alternating, going back to smaller classroom sizes and smaller class sizes, but only for parts of a day or parts of a week. And then you could imagine where a community unfortunately experiences a resurgence and an outbreak and an increased level, and they go back completely to virtual for 2 to 4 weeks. And as the numbers get right back down, you see it shift again. So you take a look at a place like BC, the entire province of British Columbia has, I know they had an extra 24 today, but in general has had a very, very small number of cases, whereas Ontario and the GTA continues to have, 100 plus, 150. The province is seeing 300, 400 cases. That's just a completely different environment than the people in other provinces, Manitoba, Saskatchewan. So I think over time we're going to see hybrid models of virtual versus classroom to allow physical distancing to occur more effectively, and we're going to see geographic variation where people might be able to go to school for many months at a time successfully, but then if there's an outbreak, have to retrench a bit to pure virtual.
Okay, and talk to me about what a second or third wave of COVID might look like. Is it similar to what you're talking about with regards to schools in terms of sectors of the economy or sectors of the city, etc., would maybe shut down and go back to an isolation as the wave passes, sort of thing, or would be a bigger adjustment?
Yeah. I think it will depend a bit on what that wave looks like, the severity of it, the geographic. Can we tie it to a certain long-term care home? I hate to pick on long-term care homes, but that's been the Canadian experience and the global experience. Can it be, what's it related to? What is the size of that outbreak? How does it look like it's spreading through the community versus being located in a more confined spot? How good is our contact tracing and testing? And so there'll be a lot of questions about what does that second, third, fourth look like to be able to know what our response will be. And we do see second waves happening. Iran is in the middle of one now, if I saw some data correctly today. We've seen other countries start to, Japan had a bit of a second wave. And so it'll really depend on what the size of the wave, what's driving that wave, community spread versus more institutional based, et cetera. And so I think the response will depend on what we're seeing.
Okay. And you mentioned the Ontario's long-term care facilities and the tragedy that's happening there. What role do you see hospitals playing in addressing those very serious shortcomings that we all know about now?
I think one of the lessons that we're learning, not just about long-term care, is that we're going to have to work better as a system. We're going to have to coordinate better. We always say we talk about our health system, but then we often end up functioning like parts of a system versus a system. And I think one of the things that's coming out of this is the need for home care, long-term care, primary care, acute care, rehabilitation, all of those different parts to really be much more coordinated, sharing information, sharing resources, sharing expertise, sharing data in order to keep each other safe and to manage the ongoing presence of COVID in our communities, or where it's exited communities where if it starts to recur. And remember, there are communities in Ontario that do not currently have community-based spread, but they have to be ready to coordinate if something should happen and it gets reintroduced.
And I guess why don't we finish up by talking about the reopening of the economy and how best to phase in that the reopening, whether it should be based on geography or the past model where it's phased in throughout Ontario. What's your feelings on that?
My sense is it's going to be a combination. And I think then we're going to have to use really good testing, contact tracing, et cetera, to sort of respond. So I think it's going to be a combination of both phasing and regional. So some regions may move through their phases a little bit quicker than others. Others may start to move quickly through and then pause. And to be clear, when I say quickly, you're going to have to see a minimum of 14 days or even a month between phases. This isn't going to be 5 days because of the incubation and presentation period of this virus. So it's not going to just be, when I say rapid, it could be, well, you're moving every 3 weeks through and then something happened and you pause or maybe retrench a phase, et cetera. So I think you'll see both phasing and regional components to this over time. And I think we're going to still learn, let's be very honest, what Sam and I are sharing with you tonight is a moment in time. We know more now than if we'd done this 90 days ago. 90 days ago, was a very different understanding of this virus. So we're constantly learning more, both from our own experiences and from experiences around the globe. We could meet again in 30 days and have a very different understanding and a different set of answers. So I think Sam and I are doing our best to respond in an environment where our knowledge of the virus is changing and the knowledge of how policy levers, such as opening different phases, play out in our society and in our economy. And so that we're in a learning environment. And I know that's unsettling to people. People want certainty, but it's hard to give perfect certainty right now. But I think Sam and I are sort of giving our best predictions with the science that we know and the evidence gleaned and lessons learned globally and locally.
Oh, yes, for sure. It's fascinating, really. Many predict an increase in mental health and well-being issues in the general public as we move forward in the new normal. How do we prepare society at large as educational and medical institutions for this?
I think this is a really important question. What I'll start off by saying is, I believe 10 years ago, you wouldn't have asked that question, or that question would not have been asked, either because people would not have thought about it, or if they thought about it, there was too much stigma. So I think the fact that we're even surfacing this as a conversation is really positively telling. And I'm so pleased that that question was asked. I'm so pleased that it was selected to be asked publicly once it was submitted. And I'm glad to say that there's far more resources that have been devoted during the last 90 days to addressing these types of issues, to putting interventions in both for the general public and also for healthcare professionals and essential workers, that I hope to continue to see that investment. So I think we want to continue to have these very open questions and dialogues, fight back against the remaining stigma that is still there, and continue to see the types of investments that are there. And so I would just encourage, if you're not having some type of mental distress and mental anxiety, and even more than that potentially, I think that would be unusual given what we're all going through. So let's have open conversations. To reference Bell, let's talk. Please seek expert advice. There's a lot of great resources online. There's a lot of free resources, and our healthcare system has really geared up to try to provide meaningful mental health to our community. So please take advantage of it. Please come in and have these conversations. And I include in this conversation substance use disorder and addiction. We've seen the data around alcohol use. It's been steadily going up, and let's have honest conversations when we talk about mental health to also include substance use disorder and addiction, and not just alcohol, other substances as well.
Sorry, Dr. Pepper, one more question for you. Are we able to capture data on how COVID affects people differently? How your DNA determines what symptoms you have, and eventually how to make customizable treatment available?
Yeah, so this is this idea of precision medicine or tailored medicine that we're starting to certainly see in cancer treatments. and also starting to get into even in certain treatments of mental health disorders. I don't think we're there yet in, we're still learning the basics of treatment writ large as a population for COVID-19. We're not yet at the stage of being able to talk about tailored cures or tailored treatments yet. It may certainly come over time. We are learning more about who's at greater risk, age, comorbidities, people with underlying health conditions, and we're certainly learning beyond the genetics about what type of groups of people. We know that in the United States, and I think in Canada, but certainly certain Black people have been disproportionately affected, and that's not necessarily genetics, that's a broader factor of social determinants of health, the types of jobs that people are able to have. And so, yes, genetics, I think that's coming down the road. I think what we want to pay some real attention to now is what do we know about certain types of jobs, certain types of people with certain incomes, certain types of living situations being at higher risk, and paying attention to those social determinants of health and really acting now. And I think there's a real opportunity. I was pleased to hear the government today announce an immediate commitment to race-based data collection for COVID-19. And we already know a lot from meatpacking plants, farmers, people working in certain industries with close quarters, people living in certain housing situations that are at much higher risk. So let's focus on that immediately as a society.
All right, great answer. Thanks. That's all the questions we have time for. Dr. Tepper, any final words?
I think I would just ask people to continue to do the things we know matter. Continue to maintain physical distancing as best as you can. Wash your hands, avoid touching your face, wear a mask. I throw them out there as sort of simple things, and the good news is they are relatively simple. And so I think I would just encourage people to continue to do that as much as possible. And I would just again thank everybody for the support they've been giving to the front lines. These are very difficult times, and your appreciation and support to the front line has been really deeply appreciated. And so on behalf of our healthcare community here, thank you.
Ron, you still there?
Yes, I am.
Oh, okay. Sorry, were you going to come back to me? Did you want me to offer some closing thoughts as well?
That would be great. Thank you, Samuel. Love to hear your thoughts.
All right. Well, first, I want to thank our hospital foundation, Terry, and your team. Outstanding effort in putting this together. It's the first time that I've participated in something like this, and so congratulations to all of you. This has been very, very enjoyable. I could say that my comments really are directed to Dr. Tepper and the entire team at North York General Hospital. It has nothing to do with aviation, but certainly expressing on behalf of our entire board our appreciation for the commitment that has been, the incredible commitment that has been shown by the entire team at North York General to our community, and how they've responded with extraordinary compassion and resolve to tackle this pandemic and its impact on all of our citizens. And despite, in fact, some challenging and sometimes, I would say, dangerous conditions, I haven't, given the policy of no visitors to the hospital, I have not been able to personally witness the collective efforts, but Dr. Tepper and I do stay obviously in close contact with one another during the week, and I am absolutely so impressed in how everyone has responded to this crisis with such poise and compassion, and really a model of unparalleled leadership within this city. The determination, the solidarity, the strength, the shared purpose, humanity, kindness, and resilience that has been shown has been remarkable. And I got to tell you, even with my experience, I saw a couple of questions in terms of learnings between aviation and healthcare. One thing that Dr. Tepper would agree is that you get comfortable very, very quickly with the widespread ambiguity and the chaos. recognizing that you don't have a crisis playbook for everything. And you just have to commit yourself for kind of navigating your way through that turbulence and adjusting and improvising and certainly learning as you go. And I have been, despite the extraordinary difficult times that everyone's experiencing, I've been absolutely blown away by the images of solidarity that have emerged, and they're absolutely inspiring, whether it's neighbors in our catchment, in our community that have organized support, the vulnerable people of our community, the businesses that have stepped up to provide support for our hospital. You've heard from me to strengthen the ability for the hospital to serve the needs of many. And we have, many of you have, like myself, have found ourselves in a situation where you're in doubt about what you can do during this pandemic. And I and many of you have prioritized helping others, even in the smallest way. And I want to thank everyone that's dialed in tonight for their contributions to that. The transformative power of giving, as I've mentioned before, in the midst of this terrible tragedy many are going through. We should seek the inner strength that really helps us not only endure, but to overcome, not looking for what we can get, but rather what we have been given and what we can give. And the only way to respond to this pandemic has been for all of us to become helpers. And for that, I'm grateful that you took the time to join us this evening and share in a little bit of education. Ron, I'll send it back to you. Thank you. And given that I am representing an airline, you'll know that I'm looking at the clock and it's 7:59. We have an on-time arrival. Ron, Dr. Tepper, it's 8 o'clock and we committed to 8 o'clock. So thank you.
Fantastic. What a great way to wrap it up. A great discussion. Thanks everyone for joining, and thank you to both Dr. Pepper and Mr. Elfassy, Dr. Tepper, and Mr. Elfassy for sharing your time with us tonight. And just to let everyone know, there's a link to the recording that will be sent to the attendees along with the survey. And we'd also like to invite attendees to join House Calls again in the next couple of weeks for another community conversation.